Hi, I'm Dr. Stephen Oren, and welcome to the health segment of Western Wisconsin Journal. I'm a family practice doctor from Hudson, Wisconsin, and today I'm going to talk about a couple of controversies that have been in the news lately regarding medical care. The first one revolves around the PSA, which is part of prostate cancer screening, and the other one is around nutritional supplements, vitamins and minerals, that type of thing. But first we'll start with the PSA controversy. A U.S. government task force said that the PSA screening test does not reduce mortality is death, and declared that no PSA screening be done for healthy men. Generally, the prostate cancer screen involves a digital rectal exam to feel for prostate nodules, and that's when the doctor puts his finger in your backside and he tries to feel the prostate for any cancer. Along with that, a blood test called the PSA is done. Prostate cancer screening generally starts when you're age 50. It's a little earlier for men who have a strong family history of prostate cancer or for black men. PSA stands for prostate-specific antigen. The problem is that the PSA is not specific for prostate cancer. All men secrete PSA into their blood, but if it is high, usually greater than 4, then cancer is suspected. But there can be other reasons why the PSA is high. As men get older, the prostate gets bigger and can put out a high PSA. Prostate infections or a recent finger exam can cause it to go high as well. There's always been controversy around the PSA. When to do it, how often to do it, what is high, what requires a biopsy. A biopsy is done through the rectum and carries a 1 in 200 risk of bad infections. That is, there's bacteria in the colon and can be introduced into the prostate. And prostate infections, acute ones, can be very nasty. A biopsy may show cancer that will lead to treatment, often radiation and or prostate removal. Both have increased morbidity. Morbidity means basically injury. For instance, radiation can lead to bladder inflammation or cystitis, a particularly painful form of inflammation of the bladder, and it can interfere with urinating. If you have surgery and have the prostate removed, then you can have impotence, which means you're not able to have sexual arousal, and incontinence, which is the loss of urine. So you'd be in the depends bracket. We do not screen men over the age of 75 for prostate cancer because they will usually die of something else before the prostate cancer kills them. There's also the saying that if a man lives long enough, then he will get prostate cancer. PSA can be useful to see if treated cancer returns. This is called a tumor marker. For instance, if you've had radiation or the prostate removed and your PSA goes to 0, that's a good thing. If it starts coming up, that means there's more cancer in your body and may require more treatment. An accelerating upward PSA in somebody who hasn't had documented cancer of the prostate, for instance, if it doubles over a brief period of time, may go from 3.5 to 7 in 6 months, then that can be a cause for concern and can be an indication of cancer and a need for a prostate biopsy. A PSA of under 1 shows a very low risk of cancer. You may not need another PSA for 5 years. Prostate cancer kills approximately 33,000 men a year in the United States. It is the second most common cancer in men after skin cancer, and there's a lot of skin cancer out there. Often I find the cancer on finger exam, called digital exam, before the PSA even goes up. So don't forget to have your yearly prostate exam after age 50. As for the PSA, talk to your doctor about it. It is a screening test, which means it is not mandatory. But if it saves your life, then it's worth doing. The other topic I want to talk about today is nutritional and supplements like vitamins and minerals. And my wife pulled this wellness letter from the University of California, Berkeley that talks about a guide to dietary supplements. And they came up with some statements that are actually fiction, but some people think they're true, and each one of these are actually wrong. For instance, supplements are regulated like drugs, and the claims made in ads on labels are held to a standard of truth and accountability. That's not true. If the label says a supplement contains certain amounts of various ingredients, you can trust it. That's not true. If it is on the drugstore shelf, that means the Food and Drug Administration has approved it. That's not true. The government requires supplements to carry warnings about potential side effects, like drugs. Supplements can be quickly taken off the market if they cause serious adverse effects. Not true. The word natural on a label means the product is safe. Not true. When it comes to vitamins, minerals, herbs, and other supplements, if a little is good, more will be better. Not true. But a lot of people think that way. Vitamin and mineral supplements may be harmful. A recent study on vitamin E supplementation showed an association between vitamin E and increased risk of prostate cancer, which you just finished talking about. A major study enrolling 38,000 Iowa women showed increased number of deaths in those who took vitamins and mineral supplements. I'm not sure if Iowa women are special. Usually they are well fed. Iron was the worst supplement in terms of mortality. That means death. Others included vitamin B6, folic acid, magnesium, zinc, copper. However, one supplement did not cause increased mortality. It actually seemed to save more lives, and that was calcium supplementation. It showed decreased mortality. So don't stop taking calcium. Since calcium absorption depends on vitamin D, keep taking the vitamin D with it. Most of those tablets have vitamin D with them anyway. Don't take a vitamin or a mineral without doctor's approval. Some people are low on iron and need supplementation. For instance, someone who's had a bleeding problem, or women who are menstruating, they may need iron. Some people are B12 deficient and need B12 replacement. It gets pretty complicated. For instance, vegetarians don't eat much meat, and B12 tends to be found in meat. They can become deficient. Sometimes they can get nerve problems in their feet or their hands. They can get funny tastes or burning in their mouth. The doctor can check the level of B12. And if someone's deficient, then it can be replaced. Sometimes it's difficult to replace and you need to have B12 shots, as many of my patients get. Using vitamins as antioxidants to protect blood vessels from clotting has not worked out in studies. Some of my patients would go out to the cardiologist. They had some blockages in their coronary arteries, and they came back on various vitamins, A, E, that type of thing. And studies subsequently showed that they don't do any good. So lately, I'm not getting people back from the cardiologist on all these vitamins. It's probably a good thing. The take-home message is, stay with calcium and vitamin D supplementation. Don't take vitamins or minerals unless your doctor says you are deficient. Save money by not buying them. And then eat a healthy diet. One other message I want to bring to people is about Pap smears. We've been talking a little bit about cancer and cancer screening. Pap smears have saved thousands of women from cervical cancer, and it's been a very successful campaign against cervical cancer. However, if people are healthy and probably have not had cancer of the cervix before, and the cancer of the cervix would be cancer of the lower part of the uterus, then women aged 21 through 65 can get a Pap smear every 3 years, just a regular Pap. Oftentimes, we've combined the regular Pap, which is known as HPV screening. HPV is the human papillomavirus that is spread sexually that causes the cervical cancer. We have a shot for that now, and that's been in the political news, called Gardasil. And the controversy with the Gardasil is whether it should be mandatory for school or not. And there's usually the conservatives don't want anything mandatory for school, and more liberals do. It's a series of 3 shots to help prevent cancer of the cervix. But what's interesting, instead of coming every year for the Pap smear, women would just come every 3 years for a Pap smear. But they still have to come in every year for the breast exam, so they need a physical anyways. So oftentimes I'll just do a Pap smear anyway. On a different note, I read just this week about a report that shows that the U.S. has one of the worst healthcare systems in the world. A little scary. Many more people die in the U.S. due to curable diseases than in France or England. This is due to poor access to health care, people with no insurance or poor paying insurance. The U.S. pays substantially more money per person than other nations do on health. And yet, we have the worst health care. Isn't it responsibility of the government to protect its citizens? Thanks for watching. I'm Dr. Stephen Adorn.